like it's going to be a problem, I would have that discussion. Yeah, for sure. Thank you.
So as well.
Well, what would you say about it?
Has it been a problem in the past? That one there?
There was maybe like a week and a half ago, there was a bit of minor discomfort. I just sort of got the clipper and dealt with it, and it hasn't been any sort of feelings since then.
Yeah. So it's
Worth
very
considering.
deep, yeah. So the lateral aspect of the nail, the two sides of the nail aren't always the same. So for this patient, obviously, you know, this side of the nail is really, really deep on the lateral aspect. So it's something that I would consider, yeah. But if you're happy to leave that one alone today, we can concentrate on this one. Right, so the best thing I think is if we just lay down so that you feel really comfortable. Is that all right? Yeah, we've got a pillow there for you so you can have a nice little snooze. Feel free to look at your phone or whatever so you don't have to listen to us talking about this sore toe.
No, fairly interesting.
Oh, okay, that's good.
Next career path.
Oh, really?
Once you're sick of treasury.
Yeah.
Something to consider. So the alcohol swab's really important. Don't forget to. Yeah. Unless,
Oh, it's here. You can do it here too.
Better than chlorhexidine or for the LA injection?
I think either would be fine. I tend to use the alcohol.
Yeah.
It's a really good idea.
And do you clean down the whole toe before you do this, or just the LA site?
Just the LA site. So, and we didn't really talk about what position, where to position the needle for this, did we? So, you can do it. You can sit in a chair. You can elevate the bed and stand up. I sometimes do it this way, especially if I've got a very nervous patient. I've got my back to them and I'm doing it this way so they can't necessarily see what I'm doing. Do whatever works for you and what feels comfortable. The easiest way to control it is using the two fingers and pushing down with your thumb. I think sometimes we're not really sure how to place our hands. You're basically going between the IPJ and the MPJ. So I had La Trobe University students ask me if we're injecting into the side of where the nail is. No, so where we do the needle is always proximal to the area that we want to work on, and anything distal to that is going to be anaesthetized. So we're doing it well away from that area. So I'm approximately going halfway between the IPJ and the MPJ, one on either side. And as we said earlier, you want to make sure that you're depositing LA right at the plantar surface of the skin. So I do that first. I go all the way down to the plantar surface of the skin, and then I'm withdrawing and depositing LA as I come all the way up. Because we know there's a dorsal nerve and a plantar nerve, but we don't know exactly where that is for each person. So there's individual variation. So you can bring your needle so that it's basically just almost poking through the skin here, and you'll see it almost poking the skin, and then you're depositing it all the way as you come up. Is that how everyone basically does it? Okay, good. I'll stop going on about it then. All right, so on your bottle you've got your batch number and your expiry on the front there. So I'm always, I'm saying, talking to Tom, how's it going? Where are you working? You got the day off today, Tom? While I'm doing all this sort of stuff.
You're working from home, Tom?
Yeah, I thought I was thinking I could do a half day, but nah.
If you can take the day off, you might as well, I reckon. I got in trouble yesterday in theatre for recapping the needle. Ooh. Got in big trouble. Ooh. So once you use the needle, you want to get rid of it and put it straight into your sharps container. If you're trying to recap it, you can, so you can stab yourself with it. So with a used needle, it goes straight into the sharps container. Yep.
So effectively bring out.
Do you just twist it off, chuck it in?
I chucked
Or
the
the
whole
whole
thing
thing
in.
I
You'll
stuck
feel
the
one of
needle.
Yeah,
Yeah.
because you'll feel one of those in like two
Yeah.
injections.
So I'm just twisting that off, yeah. So the syringe hub in the bin, Alright, so let's go ahead and get the worst part over with for you, Tom. So you're going to feel a little sting as we go in. So again, your needle sort of perpendicular to the skin. little bit of a sting. And I think it's a really good idea to, at that point, just deposit a little bit of the liquid.
Razor blade.
Razor blade. Alright, and then I'm going to extend down to the plantar surface of the skin. Alright, so you might see the needle sort of poking through there. Alright, and deposit some liquid. Remember, we're probably using about 4, and you can see it there. And then I'm just depositing liquid as I withdraw the needle. Alright, so I've used approximately 2 mils there, okay? So we're halfway through. Well done, Tom, you're doing a fabulous job. Then exactly the same on the other side. The lateral aspect can be a little bit less painful. It's often a good idea to do that one first to sort of soften them into it. So same thing again, little sting as we go in. The reason it's less painful there is because there's a little bit more soft tissue.
You're right.
So
Yeah, fine. It's tensing.
just depositing a little bit there.
It's not great.
Once it's done, you won't feel a thing.
Exactly. All the way down to the plantar surface of the skin. If you go through the plantar surface of the skin, you've gone too far, just withdraw a little bit and go again. Keep going. So about 4 mils.
Question, how come you administer that sat down?
Um,
Is it comfortable?
I would normally stand up, yeah, and do it. It's just so you guys can all see what I'm doing.
That was epic. That was epic.
How would you do it differently?
I could never do it like that.
No, neither could I. I would be
I
like,
stand and
yeah,
I stand where the camera is and
Yeah.
Well,
Same.
one,
have a hand strength to do what you did.
I couldn't do the reverse.
Manual
no.
dexterity, just
yeah, I kind of think it's easier actually to have your back to the patient, but one benefit of being down here is you can see
The
the
depth.
plantar surface. Yeah,
Like that was
So-
epic.
yeah. No, it's just, you do it so many times, you just become second nature. But yeah, I've heard this Latrobe student said, oh, if you're down here, you can actually see the raising the bleb and not raising the bleb, but the fluid being deposited down there. All right. So the worst part's over, Tom, so you can be all relaxed. So needle off, into there, and that's done.
they're okay with that in theatre too, like when they're administering local, or do they do
We-
the whole thing in the
We put it in a thing like
Oh,
that.
okay, yeah, so that gets
Yeah.
discarded later.
And then, yeah, you want to make sure you've got all your materials and stuff. So I would, oh, thank you, Jackson. Oh, there's a gown here, so I'll put that on. Yeah, having your hyperfix already trimmed and everything ready to go is great, and your toe gauze and everything.
You need a pack as well, because they probably should use.
Oh, thanks. Yeah, I will.
Another thing I just thought of
Third drawer.
Cool.
Yeah.
is obviously with the resins, when we're going to use the back to graft, we normally cut it.
Do you?
Like, well, like if I'm not going to use the whole sheet,
Yeah.
we cut it.
I just found it.
Obviously.
Yeah.
Yeah, I'll
fold
fold
it
it
off.
off.
Okay.
Yeah.
Check the money. It's got a bigger pack.
Yeah. So yeah, you can just fold over, and then you kind of got the double thickness.
Do you see any value in like massaging the toe once the L is in, moving it around
You
to
can,
distribute it?
yeah.
Or
but I want to be confident in my techniques. I know I've got the plantar nerve, the dorsal nerve, and same on the other side.
Yep.
So I think, and then I'm going to be checking it for Tom, making sure that
Yeah.
we've done that properly. Thanks so much. Before we really get stuck into it. So what you can do, I'm just going to put everything here for a second. And the way you set it up, you know, do whatever works for you. This is for the floor, so you normally put that on the floor, just so you don't get mess all over the floor.
Yep.
So you can touch the outside of this pack. Okay, so everything on there is sterile. So now everything not on there is not sterile. And we can put our other things on there that we're going to use. paper in here is sterile, so you can, we'll do that in a second. And then these things aren't sterile, and that's okay. Oh, you do the same as me?
I just do that. That's my idea.
You do the same thing?
Yeah.
That just makes it easier to get it between the second toe.
How's your toe feeling? Is it tingling, numb?
Um,
No different?
feels pretty normal, but I guess.
Sometimes people just say it feels really tight because you're forcing fluid into a toe where there's not a lot of room. I tend not to use these because I don't think they're very flexible for wrapping around, but you know, use whatever you like. I tend to just go with some Cutiplast. It's really flexible and it's really absorbent.
Even if it's non-sterile Cutiplast?
Yeah. Yeah. You can put some of those in the sterilizer if you want.
Yeah.
But I think that's
The
fine.
phenol and betadine is already using this. That should cover it.
Yeah.
So you unpack the gel in it now.
You may do a study in like.
So that's sterile. So it's in a paper sort of thing. So so yeah, you can either just tip it onto there or you can.
Touch the outside layer with the sterile packet.
Because yeah, the outside of the packet is not sterilized, so I don't want to touch that with my sterile glove on. Yeah. It's okay. So I would probably. Thank you.
Oh!
On camera.
Who's in this room?
This is the Alex
Who
suite.
uses the hand sanitizer? I'm so sorry,
It's
Jen.
alright. I've had worse.
Oh no.
Alright. So I mean, you know, and this is getting a bit over the top, but basically the correct technique for this is, and this is when you've got a sterile gown, that you put your fingers in and you sort of flip this over. But I think really just, you know, you're touching, that bit there is going to be inside, so you can touch that bit and just pull it on. I think that's okay. And then that part's all still sterilised. You can go a bit over the top.
Hex or anything like that.
Yeah, so I should have poured something into my galley pot and I just forgot. So, sorry, yeah, Jackson, do you mind just giving us a bit of floor hex? And I would normally have some betadine on here as well. Yeah, thanks.
Do you want some?
Yes, please. And so what I'm just going to do now, Tom, is just check that all the pain's gone. So let me know if this hurts. So you'll still feel me touching your toe, but hopefully it's not feeling sore.
No, like a little bit of sensation as you were pressing in, but no pain there.
Is that pain or just that you can feel the pressure of that?
A tiny bit of pain, but mainly is pressure.
Yeah? So what about on this side? Any pain there?
No, that's
So
no,
really,
no
you really
sensation.
want to, do this in. And of course, you know, that's going to be more appropriate if we're doing both sides. So we'll check this side again. Is that sore there?
No.
No. That's all okay?
Yeah, it's all okay.
Okay, so I think that's okay. So that would have been quite painful for Tom if, and also I forgot to get 15 blade and a beaver blade. So that would still be a good
Do you
idea.
want to say the back and lift it up?
Yeah. That's what I think.
The beta is already attached on.
Beaver's attached? Okay, great. Alright, so on with the tourniquet.
That was smart when you just separated and put it on.
Yeah, so they're pretty stretchy. You know how they had a plastic ring around them? That there's a whole controversy about that now, whether that's meant to stay on so that you can take it off without dropping it, so that you can use it on the next toe, or whether that's meant to be removed before sterilising and everything. But I think that little plastic thing is kind of useful.
I know what you mean.
You know what I'm talking about? They come with a separate plastic ring
It's like a
that
tag, like a
Yeah.
garland.
yeah, looks like you should clip it off. Thank you.
It's okay.
Can I get you to open the blades and just tip them
Yep.
onto the green
Jeff, you can do it.
thing for me, please? So again, if you're swabbing with betadine, you can see exactly where you've gone with this and that you've got it into every little bit of the sulcus and everything.
Did you want that fresh one or?
Oh, sorry, yeah, there was already one there, that's fine, thanks. And so where you mark the nail and where you decide how much you're going to take off is really up to you. Tom has never had problems before. I'd probably, if we take sort of that amount of nail, you want to draw a little mark there. If we took that amount of nail, Tom would still be left with, you know, quite a reasonable amount of nail, and I'm going to take away the part that's under the skin and causing problems. So sometimes it's as simple as it being at that corner. See how you've got that margin, and that margin, it's almost at that corner. It's not always that, but I think quite often it is. All right, so yeah, this is a little blunt. This is fine for now, but if you get a fresh beaver blade, you can score the nail really easily and make it really simple. Your thwaites, so we talked about this being the narrower side and angling this towards the base of the nail. So I've got to make sure that I don't shift the position of my thwaites when I'm doing this.
Did you need to move the chair up at all so you're
Ah,
not bending?
look, that's all right. It's all good, thanks. So it's not that much force that's required, even though I haven't elevated anything yet. And then, what's the next step? Continue that with the beaver. So look at the beaver. With this one, it's sort of sharp on both sides, so it doesn't matter whether it's that way or 180 degrees that way for this one. Some of them it does, depending on the shape of the blade. So you're just following that incision that you made with the thwaites, and you're just continuing it forward, making sure that you're not changing the angle of your hand. And did you see that? Yeah, that was a good demonstration one, wasn't it? So then you can use your elevator. Now, this one's not too bad. You know, it's for this toe, it's an appropriate size. I use this, it's just a bit smaller and I find it a little easier. So I'm, using that serrated side against the nail on the three aspects. So sort of that dorsal side. And if you're freeing up and there's debris and things coming, just take that with you. And then underneath. And along
Tom
that,
doing alright?
that board there, yeah, thanks
good.
Taz.
Picking spots on the roof to stare at.
Feel free to do whatever, go on your phone, relax, don't feel like, you know, you
Yeah.
have
So
to.
basically flicking it out with
Yep.
the black spot.
Yeah, so it's
Cool.
it's a little bit stuck down there, so yeah, I'm sort of sweeping around the aspect of it there. So it's actually stuck with skin, and I think that's most usually the case. This skin here is what's keeping it. That's what I'm freeing it from. And you can see there, Tom, some of that skin sort of coming away there.
Yeah.
Yep. So this is the part that you don't want to rush. If I was to use the mosquito forceps now, I'd probably break it off. So I'm taking my time and making sure that it's released on all sides. See how there's some other material that's coming out that's causing it to be stuck.
How you doing, bro?
Yeah, good. Ignorance
Okay.
at least.
Normally I like it just to slip right out there, but this one is just not going to. So I am going to get my mosquito and I'm going to grip it really nice and deeply, and I'm just going to give it a little twist because I think it is skin that's sort of keeping it in there. course, playing up when doing the demonstration. There we go.
It's huge.
So it has, it had that sort of extra layer that was all embedded in the skin and that little sharp edge there. So I'm just gonna check because I wasn't totally happy with the way that came out. So I really want to check down there and see what the deal is. Is there any fibrous tissue?
I'm really liking this technique. Jen Black's file seems to be working really well.
It's my favorite. It's
Yeah.
my go-to for this
It's easy to
procedure.
handle as well.
Exactly, it's so familiar,
Yeah.
isn't it? Yeah, something we use all the time. Some people actually have a double matrix, so they'll have a double layer of a nail at the base there. So you sort of have to. So sometimes there's just some bits of skin and things, and you might want to use your 15 for this. Try not to,
So you would make sure you clear all that skin out. with
yeah,
the
those
blade.
little bits of skin are what potentially going to interfere with that healing. So this is sort of like HK that can all go, and there's something there on the dorsal aspect of the nail. And you can use the curette, and I think it is really a good idea to use a curette, and you'll be able to feel if there's any fibrous material down there. It's feeling better now, so you're just feeling for soft tissue there and feeling along that nail edge. I'm just trying to agree with myself if I'm totally satisfied with that.
Are you filing at all or just clearing?
I'm sort of just making sure that whole nail edge is smooth and straight, and then I'm sweeping the blacks across the dorsal aspect of the nail just to make sure. Alright, I think we're okay. Yep. Alright, so can I get some phenol? Yeah, so I should have done this earlier. So do you want some gloves on? Yeah. Any questions about any of that stuff?
Would you ever, just anecdotally, I often find that when you do one side, then the other side becomes a problem down the track. Like, would you ever just do both sides, just kind of
I
like
had that
even
discussion.
Even it up, or?
I would have a really good look at the side of that. I'm reasonably satisfied with this one, that we can see that edge and it's pretty flat and straight and everything.
Yeah.
That one I think is potentially, that would have been the one that I would be.
So I mean,
But
on the same nail, do you ever find it?
I sort of think freeing
Have
up
to
one
tip it.
side almost helps both sides,
Okay.
because the whole thing is narrower
true.
and stuff. Yeah.
Could taking away from one side throw the mechanics of the nail off or anything like
I
that?
don't think
The
so. Yeah.
Extra weight on the other side. Or?
Yeah, that's fine. Yeah, thanks. I think it's okay. Yeah, if it was that one, I would have been addressing it at the same time.
Jen, for this one, would you consider putting felt like you were
Yeah.
discussing?
Yeah.
Do you want me to get some for you?
Yeah, we can do it in a second.
There's something on
You
the
can
back.
even do it like, have we made a review appointment for Tom? Yeah, so if he's coming back in 2 days, you could do it then. Yeah. If he's going to be at home and not doing much for the next couple of days, that's okay. You could do it at day 2.
Yeah,
I
I've
use
never
the
done
blacks.
that.
I
Use a
just-
curette.
Yeah.
So you kind of just
So at this
Really
point, I
skinny
should be
edge side.
satisfied that there's no problem. So I'm just sort of dipping it in and moving it around. So
Yeah,
you
so
could
you're
use
not really
anything.
like scooping it and
No,
bucketing
no.
it in. You just sort of.
So a drop is all that's required because on contact it should be toxic to the matrix cells. Let's have a look at what's going on with this. So I can see a tiny bit of blanching here. And just wipe it so you can see. Just ever so slightly. This is going white and that's going white.
Yeah.
Can you see that whiteness? Yep. So that tissue in there is all white.
Do you just like with the 30 seconds? Do you just go off feel, or do you actually time it? Or?
I've seen surgeons actually timing it off the clock, and I think, gosh, you know, but no, I'm just, yeah.
There's not exact science, like.
For me, it's not.
You're looking at the tissue changes
Yeah.
as well, right? Which is probably more
More
indicative.
important,
Yeah.
Okay, so you could either flush here or you could just start counting your 30 seconds again. I used to always do flushes in between. To me, this is just 90 seconds, but you know, both work. So what do you reckon? We've probably done a minute or so.
Yep.
So you can see I haven't really tried to scoop up a lot of phenol, but there's plenty in there.
Yeah, I think the cotton tip can sometimes be a bit overkill, draw up a lot.
It probably absorbs a lot, so it's probably not getting into where you want it to go either.
Yeah, true.
And you can't always fit it either. Like you have to
I
like.
used to have like pull those bits up.
Shred it off.
Yeah, no, it's not as neat.
Alright, so then we're going to wipe that away, and what we want to do is press on the toe and see all that fluid come out. That's the phenol, yep. So if you don't do that, it's still in there. So we're
right.
flushing that,
So
getting
is that
that
what you
out.
mean by flushing it out? Okay.
Yeah, so I would normally use betadine for this, but it doesn't really matter. You're just making it clean, and you can just squeeze along there and just get any of that phenol out. Okay, so that's pretty much it. Then I put my thumb here as I'm removing the tourniquet, just to prevent any further injury to the rest of the toe. But because we haven't elevated the rest of the nail, I think it's less of an issue, but anyway, that's just how we do it.
Put some colour back.
And then we'll just give it a moment and make sure there's no bleeding. You've done so well, Tom, but it's all finished, but I'm just going to put the dressings on in a second, okay? So the phenol does cauterize the bleeding. You could go ahead and put the dressing on. If there's any bleeding now, it's going to be sort of a slow sort of thing. So I think we could go ahead and pop the dressing on. So I just tend to double that over. So just fold it in half, stick it on there.
No packing or anything like that. Just pop it on
No,
top.
packing I think can potentially cause problems. So if it is going to bleed a little bit, we want to allow that to happen. We don't want to block any of that from happening.
And create hypergram as well. You just put more pressure there.
Yeah.
Pull it out, sort of rips the thing, or
Yeah.
sheds the one surface out.
So I tend to do a double cutie plus that's going to absorb any little bit of bleeding that might occur. And I also do say to people at the end, you know, if you see a tiny dot of blood on there, that's okay. It's nothing to worry about. If it's actually actively bleeding, that's when I want them to call me. I give every person my mobile number after I do a PNA. Guess how many phone calls I've had?
0.
I had one this year. That's the first one.
Oh yeah.
Yeah. From Noah.
No, yeah.
He started to bleed about 6 hours later, which I just think is the most bizarre thing.
What did you do?
I told him to elevate his foot, put an ice pack on it, and put some compression on it, and put a bit more bandage around if
Do you want that
If
part?
it wasn't needed, I'm just gonna trim it a tiny bit. Oh, it doesn't matter. And then I called him back in 10 minutes and it stopped, so it was okay. But I was prepared to think, okay, I'm gonna have to go over to his house and see what's going on. Otherwise, he would have to go to emergency. But yeah, he was a healthy 20-year-old on no medication or anything, so it was really odd. But yeah, I just think it's better that they can call you rather than them absolutely panicking and having to go to hospital or something. Yeah, that's just what I would prefer. I've never had someone use my phone number inappropriately or anything like that. They do say don't give your phone number out. I don't know how you feel about that, but I
It's
just...
certainly probably not something I'd expect people to do, but certainly suggesting that if you're comfortable with that, but, or else make sure they ring the clinic and whoever's available will certainly take the call and deal with it.
We've even got our own personal emails, so
True.
if they do email, you can make an informed decision to call them if you think a phone call's appropriate.
Yeah, if you'll see the email, I tend to not be looking at my emails in the evening and stuff, so I just prefer a phone call. I was just going to put a little bit more Cutie Plus on, just to...
Cutie Plus is right there.
Oh, no, sorry, not Q Plus, the Hyperfix. Yeah. That one. But yeah, that's kind of it. Any questions for all of that? So like I said, yeah, you can use whatever dressings you want. I don't think it matters at that point, as long as there's something absorbent and something that's stuck to the foot. So I put Hyperfix right, distal to that to just try and keep it in place.
We'll obviously put up this video up on the hub, but there is also like a video that I've filmed of how I dress it, so if you just work what works for you.
Yeah. And it certainly makes the whole thing easier if you've got a wonderful patient like Tom who's just so relaxed, and makes it so much easier. If it's sort of not sticking here, you can put a bit of sports tape over that as well, just to hold that down, but that looks all right.
Got a few plastic bags, Tom, that you can wrap your foot around for showers next few days.
Yeah.
Yeah.
So I'll just sit you up and make sure you're feeling okay. So, there we go. Thank you for letting us all be watching and talking about that.